Hello, my name's Helen Moorey. I'm lead skin cancer nurse at University Hospital Southampton, and I'll shortly be introducing Ian Goddard to you, who is a very well-known patient of ours who received immunotherapy some years ago, who's kindly agreed to share his experience with us today. I'm really mindful I'm speaking to a very experienced audience. All of you will have given large amounts of immunotherapy and witness the impact that can have on people. I guess I wanted to use this session to reflect on that, think about how we support patients. Are we giving them adequate information? And is there anything else we need to learn from that? Of course, difficult to gather from just one patient, but I think Ian's story is quite a powerful one. So Ian was referred to us in 2017. At that time, he was 65, married with 2 adult children who live abroad. A challenging year for him in that regard, as you can imagine. And he was a retired naval officer. He described a significant history of bowel cancer in his family, but nothing else specific in his past medical history for us to note. He presented with stage 4 malignant melanoma, and that was wild type. He had his primary melanoma resected back in 2010 and was fine until 2015 when he presented with a recurrence in his left axilla, for which he was offered block dissection, and that uncovered 1 involved node. He then subsequently underwent routine scanning, and a CT in November 2016 suggested metastatic recurrence, and a PET then confirmed uptake in his adrenals as well as the axilla. So he came to us in February 2017, and at that time was enrolled into the Checkmate 401 study. So the early days of Ipi-Nivo, we were pretty green with it, and it was a learning time for us all, I guess, and have reflected on that with Ian since. March 2017, he was discontinued after 2 cycles. He'd had a very early good response, but had developed hypoadrenalism and a steroid refractory colitis, from which he had a pretty torrid time. He underwent 8 hospital admissions and totaled 36 days in hospital whilst that was being managed. And in between times, the colitis and diarrhea was having an impact on his life at home, and which he was managing admirably, but was certainly having an impact. He's been really well since, but interestingly presented with a new melanoma, a new primary on his right forearm in March 2020. That's been fully resected, and restaging scans since have been clear. And you will see for yourselves in a minute how well he is, and very much making the most of life. COVID limited, of course, at the moment, but otherwise enjoying life. I think I just want to delve a bit deeper into what it was like for you having immunotherapy treatment, with the obvious implications I've described already and its repercussions for you. So talk me through, what was the experience like for you?
I was fortunate to get onto this clinical trial and was given a very comprehensive brief, written brief on all that was going to happen. And I think, like most people who are given data or have ever eaten a paracetamol tablet, there's a big leaflet inside that you never read because you think nothing like that is ever going to happen to me. Whilst obviously now, some 4 years or so later, I'm very happy with the way things have turned out. I assumed that I'd get the stuff, it would either work or it wouldn't, and then I'd be merrily on my way, and things didn't quite turn out that way.
No. When you assumed you'd get the stuff and see what happened, I think I've got this real thing that we give so much information initially, it is difficult for you to take it all on board, and perhaps you don't want to even at that point. Did you think, I will just have to put up with whatever it throws at me? Or?
I don't think I was fearful of the consequences of the treatment because, I mean, whatever they were, if it worked, it was going to be an awful lot better than the alternative. Because I'd never had an allergic reaction to any drugs before, I didn't really expect to be hit with the side effects that I did have, And I also think that having read the brief which said the treatment would come in 4 doses 3 weeks apart, to only actually get 2 doses was quite a setback mentally for me, because I assumed that because I had the violent reaction I did have, that I'd probably miss my chance because I didn't get the full course of treatment.
So tell me, when it hit you, what happened?
The first indication we had that things could go a little bit awry was when, during my second infusion with the chemicals, I developed wriggle and ended up sitting in the chair shaking uncontrollably, and that had to be controlled with drugs before they could finish off the treatment. 7 or 8 days after that, I developed these very, very severe headaches, which was unusual for me. And my wife, who's got a nursing background, said this isn't right. And I rang the number I'd been given, was admitted to the Mayos ward with a probable attack on my pituitary gland. The headaches were something I'd never experienced before. And it was only during that process that the clinical staff came and told me that this was probably the immunotherapy beginning to work, and my body was attacking my pituitary gland, and that's what was giving me the headache, which wasn't much of a comfort at the time, because I discovered quite how important the pituitary gland is to general well-being. But that was the first indication of a side effect, and I always remember Professor Ottensmeyer telling me, he said, "That's all right," he said, "when the headaches go away, it'll mean we've destroyed your pituitary gland and you'll be feeling better," which duly happened, of course.
Yes. And those headaches, when you had them, did anything relieve them?
Cannot recollect any of the drugs I was given really did very much. I was pretty much out of it for at least 2 or 3 days. I mean, just this violent banging away in the right-hand side of my head, you know, and it was particularly uncomfortable. But it did go away.
Before you heard that it was probably your pituitary gland causing problems, did you have fears did it make you wonder what else was going on?
To be honest, it was initially, I didn't associate the headache with the treatment. It was only when I was admitted and everybody got in a bit of a flap that I realised that this was probably associated with the immunotherapy.
And if Judy had prompted you to get it looked at, would you have done, do you think?
I suppose eventually I'd have probably ended up collapsing, or the headache wasn't something I particularly expected to get. But she, as we talk on, throughout the process, she was always one step ahead of me in recognising that things that came up and happened were things that were important. But just in terms of a headache, we all get them. We don't all get them quite as bad as that.
Indeed not. And what happened next?
About 4 or 5, 6 days later, I started getting diarrhea, which is, again, something I've very, very rarely suffer from. We found some incredibly out-of-date Imodium in the cupboard, and I took a couple of those. When they didn't really work the first time, Judy said, "You've got a phone." So once again, I phoned the Mayos, and they said, "Come in." This is really the start of a fairly long process of recovering from some pretty severe colitis, which was, again, a side effect of the treatment.
So you were admitted fairly soon after the diarrhea started?
Yeah.
And how long were you then in hospital with that on the first occasion?
I think the first occasion I was in about, I can't remember, 4 or 5 days perhaps. I started on steroid treatments, which dampened the whole effect down, as happened on a number of occasions throughout the next 3 or 4 months. I would be apparently getting better. 4 or 5 days later, it would all start up again, and this became a bit of a cycle really over the next 4 months.
And at its worst, how often were you going a day?
Maybe a dozen times perhaps, because it went on through the night as well. I would just be constantly going to the toilet. which made getting to the hospital to be admitted quite a challenge because it's a 40-minute drive.
And I know you told me that on dog walks you had to be prepared as well.
When I was discharged, the one thing I vowed that I would do is try and live as normal a life as possible. And we've got a dog, and dog walking's always been one of our great pastimes. Even when the steroids started to affect my muscle tone and make me very, very weak, we still used to take the dog out, and I would slowly walk around the woods, suitably equipped with toilet paper and plastic bags, so when circumstances demanded, I could rush in behind the nearest bush, make myself comfortable, and then clean up the countryside so no one else had to suffer what I just had. So I'm not ever going to let this beat me, so I'm just going to keep going.
So was that a regular event, or did you function in a just-in-case mode with dog walks?
At the height of it, if you went out for a dog walk, I'd find a bush sometime on it. But because we weren't going very far, but then I wasn't going very fast.
And how long did that go on for, Ian?
The diarrhea started late March 2017, and I finally got discharged late June with a bowel that would behave itself. I just then had to go and just go home on a tail off of the steroid treatment. Then the worst was over, as it were.
Are there any long-term effects on your bowel, or has it returned to normal?
I think I've been pretty normal. I wouldn't feel that there's anything at all wrong with my bowels now, and I just have a normal bowel movements as I always did before it all started.
You've just mentioned steroids and the impact they had on you, and talked about your leg weakness. Did they have any other fallout for you?
There was certainly an effect on me mentally. I've never really been a particularly emotional person. I discovered as time went on that I would suddenly have these bouts of, I wouldn't say depression, but bouts of emotion. And I particularly remember one day I was sitting talking to Dr. Wheater, who was looking after me, and he was so nice, and everybody was all so nice, all the staff and the wards. I'd suddenly find myself bursting into tears at how nice everybody was, which was quite a new experience. And I couldn't understand it at first, and then Matt said, you know, steroids do that to you. You know, you shouldn't be concerned. You will find this happens, and so such it was.
Helped.
Oh yeah. Once I realised it wasn't just me falling off my perch or something. It was the effect of the drugs. It helped to know that that's what it was.
But you described there two really big ways in which you were out of control, with your bowels potentially and emotionally feeling very labile. So that puts you in quite a vulnerable position, doesn't it?
Yes, it was particularly distressing to just feel myself physically deteriorating, to be honest. That did impact me. But I mean, when I was at home, at the worst of the treatment, just getting out of a chair to go to the toilet was difficult. I mean, you just have to mentally gather yourself to literally find the energy to stand and stagger 20 yards to the loo. Yeah, it was very hard in some ways, looking back.
Yes.
But at the time, it's just, you know, what you had to go through. So you didn't particularly think that much of it, I don't think, in those terms, in the terms that we're discussing now. In the terms of something you had to deal with, so you dealt with it.
Yes, yes. But looking back, you see the significance of it and how difficult it was for you.
Yeah, I think so. Yeah.
What was the worst bit?
I think the worst bit was the pituitary gland problem, because it was so painful. Although on one of my visits to hospital, when I was put into isolation because I'd been diagnosed with paraflu, I acquired a cellulitis infection in my feet, and all the flesh came off my toes, and literally they were red raw, and the pain was excruciating. And of course, having to get up to go to the toilet every 2 or 3 hours with feet with no flesh on was extremely uncomfortable. And it took a while for the medical teams to actually get on top of it. And funnily enough, one of the ways we actually eased it back to normality was bathing in salt water, which is a time-honoured remedy, which my wife suggests, but that was painful. That really was perhaps the worst bit of the lot. I was waking up in the night just buzzing the buzzer and saying, you know, I just can't stand this, can you give me something else?
And did anything help with that pain other than the salt water?
Well, the salt water was really to ease the soreness, but the pain, I mean, they tried me with Oromorph, and I think it was cocodamol, which...
You've always dealt with it with such a jovial but matter-of-fact recall, and you've been remarkable. When you look back, is there anything you wish had been different in terms of your understanding or preparation for what was coming?
I think the thing that I didn't hoist in, the fact that getting 4 doses of the combined drug regime down you was not actually that common, and so I assumed that you needed 4 doses to be cured, and then when I only got 2, I found that a little disappointing, because I kind of assumed that my ticket had been punched at that stage, as you might say. I was told by Dr. Cridis and Dr. Wheater that they were beginning to find people who had the most adverse reactions often had the best results from the cancer treatment. But the one thing I do remember is I had a lump on the top of my sternum. It took about 4 or 5 days for the biopsy to be arranged, and this was just after I'd had the pituitary problem, and I could feel it melting. It was just going softer and softer. And when they tried to take the biopsy, there was nothing left there but mush. And then I began to think, this might just be working. Yeah, quite marvellous. And the professor was terribly excited.
I'm sure he was. I can imagine him punching the air. So in terms of your pituitary gland failing and how we've successfully destroyed that, has there been any long-term fallout for you in that respect, in terms of your hydrocortisone maintenance and impact if you're feeling unwell?
Now I'm stable on the tablet regime, as long as I remember to take them, of course. It all works really well. I do occasionally forget, and my daughter persuaded me to put an alarm on my phone at 9, 1 and 1800, which works a treat as long as I'm not busy doing things. But Trudy's very good at giving me a nudge. This morning, before I came out to meet you, I was rushing about doing things, and I totally forgot to take my pills until just before I left. She said, "Have you taken your pills?" Yeah. So she's a very useful citizen.
And do you notice it if you do forget one?
I can't say that I do, although once or twice when I've forgotten the evening dose, I suspect I tend to doze off more on the couch watching the telly than I normally would, although who knows, you know, I am 70, so.
So you've mentioned on a few occasions what a stalwart Judy has been in the background, keeping an eye on you and nudging you towards the right management. If you had been on your own through this, do you think things would have been different in terms of when you would have reported side effects, how you might have approached that?
Yeah, I think there's no doubt that my immediate reaction to things going wrong was, oh, it's just I've got a headache. Oh, it's just I've got a bit of diarrhea. What can I have eaten? And it's without a doubt been Judy that's said, no, this isn't right. And it would have taken me longer, almost every occasion, for me to actually ring up and say, this is happening, what should I do? And in particular, towards the end of my treatment, when my bowel problem had been solved and I was on the taper of prednisolone, and when it finished, I became more and more lethargic. I would come back and sit down for lunch and fall asleep in my chair. I just didn't realise that that was getting worse and worse. And it was on a Sunday evening. Julie said, "This isn't right, there's something wrong with you." And she said, ring the Mayos and get in there. And they took a blood test measuring my cortisol levels, and the doctor told me, once they got the results back, that it was immeasurable. And she said, if you'd left it much longer, you might not have necessarily been back to bother us anymore. And that's when I started on cortisol, hydrocortisone. The endocrinologist did a trial with me stopping taking the pills, and they discovered that my endocrine glands, which is where the main tumours were, my adrenal glands, they're basically just packed up altogether. So I'm on it for life now.
Is there anything else you think it would be important for us all as healthcare professionals to know, based on your experience?
The treatment I had and the people at every level, on every ward, were absolutely fantastic. The little message I would deliver is perhaps to make it more clear to people starting on this immunotherapy regime, is that not getting 4 doses isn't something to be particularly concerned about, because when I only got 2, I kind of thought I'd probably punch my ticket there, and that was it. And although Dr. Gridis and Matt Wheater kept telling me, oh yeah, but when you get the bad reactions, that's often a good sign, you tend to think they're just patting you on the head and trying to make you feel better, whereas it subsequently appears to prove that I was very lucky to come out the way I have.
It's been a real privilege to be able to talk to you like this today, and I'm sure everyone else will benefit from it enormously, so thank you.
Thanks, Helen, and thank everybody who made it possible.
So I just wanted to finish with some reflections from me as a nurse specialist working alongside my clinical colleagues and patients when they're receiving this treatment. I marvel at, am increasingly struck by how complicated the information giving and consent taking process is around these treatments. As options increase and we have more awareness of the potential impact, it's really difficult I think, to pitch information giving sufficiently to equip people and help them understand what treatment they're going to have, but also not to scare them at a time that is already anxiety provoking and stressful. And I don't have the answer to that, but I'm just mindful of how difficult and complex it is. As a nurse specialist, then supporting patients in decision making around their treatment and which option they may go for if options are presented to them. In the light of so much uncertainty around outcome, and with what we see at times as some really significant toxicities, but are not a given. So how much do you prepare and equip patients for that as a possibility? I think also I'm starting to think I need to be a bit more structured in my practice around risk stratifying patients and need for follow-up in a more specific way. As you can see, Ian is a bright, articulate man, very much on top of what's going on in his life, but it was his wife that prompted him to get suitable help at the right time. And do we therefore need to think a lot more particularly about which patients might be more vulnerable and needing further monitoring than just clinic follow-up, and how we might do that? I've recently been introduced to patient activation measures, but that might be useful in assessing the need of intervention that might be needed, stuff around trying to find out from a patient how much responsibility they choose to take for their own healthcare, or whether they see it sitting completely with the clinicians. And that might just help guide us as to the level of follow-up we offer.